So this is about the Shodhana. Now we will move on to the some of the common clinical condition and where these Shodhanas are plays important role. The first condition which comes to the clinic generally, the common condition, we can see the eczema. Eczema. Eczema, there are two types of eczema you can see. I think these classes are over, but to brief, to recollect your, refresh your memory, I will give some points. Eczemas are generally inflammatory in nature, and generally dermatitis or inflammation of the skin is seen. So in modern medicine, whenever they are not able to diagnose a particular condition, they use the terminology dermatitis. It's a very broad terminology. Sometimes the eczema may be genetic in origin also, especially when it comes to the children. By birth itself, since the time of birth itself, they may be having some kind of eczema. But generally, such eczemas will disappear after a certain age of 8 or 9 years or 10 years. Generally, this eczema is seen in young adults of both sexes, and the aggravation is very much seen during the summer seasons. So, as I mentioned, there are two kind of eczema you can see. One is the wet eczema, and the another is the dry eczema. Okay, so acute, subacute, and chronic. Three stages also we can see. In acute condition, redness with an ill-defined border, papules, large blisters, vesicles, and scaling also seen. In subacute condition, redness and crusting are present without the extreme swelling. In chronic condition, it is less vesicular, more scaly, skin pigmented and thickened and with the fissures. According to Ayurveda, eczema is a minor form of leprosy. So Acharya says that it is a minor form of the leprosy only, the eczema, and is caused by the aggravation of kapha in addition to vata and pitta. So in Ayurveda, the eczemas are generally mentioned, nomenclature named as vicharchika. So many of the skin ailments comes under this vicharchika, like dermatitis, eczema, etc. Also can be brought under the broad heading of the vicharchika. Main dosha involved will be kapha, and there will be association sometimes maybe with the vata and pitta. If it is more predominant with vata, there will be dry vicharchika, and when association of kapha and pitta is there, it will be sravi vicharchika. Acharya Sushruta gives these two kind of subdivisions for the vicharchika. Okay. So how this vicharchika and eczema comes to similar? When it comes to lakshanas, the pidakas, saraga shopa will be seen in vicharchika. In eczema, inflammation with marked reddening. So raga and shopa will be seen. Then pidaka, kushtarogadikari, pidadayiki, shudra spotaka. So spotakas, the blisters or vesicles we can see. So or sometimes papules also. So this is seen in eczema and vicharchika. And in vicharchika, kandu, eczema, itching, similar. And srava, lasikadya srava will be seen in vicharchika, oozing with the serum in eczema. Then rukshata, sometimes in vicharchika, dryness also we can see in dry eczema. Then raji, different discoloration or linear discolorations we can say. In eczema, there is linear marking or lichenification we can say. In paka, in vicharchika, paka we can see. Same time in eczema, pustules we can see. And in vicharchika, brena and ruja is seen. And in eczema, ulcer formation and irritation because of excessive scratching, pain will be there. Then in vicharchika, varna, lohita varna is seen, or shyava or shyama varna, blackish or blackish red in color is seen in vicharchika. When it comes to eczema, they say that reddening in acute stage and hyperpigmentation in chronic stage. So there are ruksha, vatika predominant ruksha variety in vicharchika and pitta kapaja predominant sravi variety in vicharchika. Similarly in eczema, dry eczema and wet eczema is also seen. Coming to the management of the vicharchika, as predominance of kapha predominance, we should first think about the vamana in eczema. And Vichachika need not be always localized in nature. Sometimes the Vichachika can be seen in the entire body also. All body Vichachika also seen, because I came across such cases also. So that I will explain in the later classes. In Vichachika management, the Vamana and Virechana plays important role, because Vamana, as predominance of Kapha is there, Vamana can be performed. And if Swavi in nature, because of the involvement of Pitta and Vata, Virechana will be the best line of the treatment. And Jalokavacharnam, of course, Jalokavacharnam is also very important in the management of the Vichachika. So the different kind of Raktamokshana modalities also we can utilize in Vichachika. Then Eladigana Lepa. I'm not going to detail into the Shamana Ushadis, because I think already that part is dealt. So Eladigana Lepa. Eladigana Churna can be applied. If it is Sravi in nature, we can apply the Eladigana dusting also can be done, so that it will help to reduce the secretions. And if it is very thick in nature and very dry in nature, even after the Vamana and Virechana and the Shamana Ushadis, after application of the other lepas, etc., sometimes the lesions becomes very dry and which will remain there over the skin. And there will not be any lakshanas like itching or pain, nothing will be there. Only a very dry, hard area will be remain. In such conditions, we can apply the Eladigana lepam along with the tamarind leaf water. Tamarind leaf should be boiled in water. In that water, the Eladigana churna should be mixed and applied. The other some of the lepas we can utilize is the Nimbaharidradi or Nimbadi churna, etc. also can be utilized for the Vichachika management. But Nimbaharidradi is generally in Kapha predominant conditions, and if only Kandu is there, then you can utilize the Nimbadi churna also. Especially in children, if Kandu is more and whole body is involved, if the Vichachika is since birth they are having. In small infants also we can see the Vichachika. In such conditions, you can use the Nimbadi churna mixed with some baby powder and mixed properly. Then you can dust that powder, combination of this powder over the affected areas. So this will help to reduce the Kandu also. Okay. Then Aragudati Kashayam, generally in Ruksha kind of Vichachika, Aragudati Kashayam, and in Sravi kind of Vichachika, Patolakadronyadi Kashayam will be very effective. The Manibhadragulam. So Manibhadragulam is one of the very important yoga, especially mentioned for the Virechana purpose. But apart from that, which is mentioned very clearly in the Kushtadhikara itself. So that is why the Manibhadragula plays a very important role in the management of various kinds of skin diseases. So in my clinical practice, I prescribe Manibhadragulam in almost all the skin conditions for the Nitya Virechana as Nitya Virechana. Okay, so Manibhadra can be a sure drug in your prescription in all the skin conditions. Okay. If it is Strava is more, in such conditions, apart from Patolakadronyadi Kashayam, you can use the Amrutottaranga Kashayam with Villuadi Gutika. That is another combination which causes more Rukshata in the body. So which will help to reduce the Strava and also keep the area very dry very fast. Okay. So again, Amrutottara, because of its, which is mainly mentioned in the Jwara Chikitsa and also utilized in Vatarakta conditions. And because of involvement of the Amrita and the Haritaki, etc., which have Ustagna action also. Okay. And coming to the dandruff, another common condition which need not be go for any Shodhana in initial condition. If it is very chronic in nature, of course, you have to go for the Shodhana therapy. So dandruff inflammatory in nature sometimes, and sorry, this slide is therapy. So dandruff inflammatory in nature sometimes, and sorry, this slide is changed. Okay, leave it. In dandruff, generally what happens is the excessive dryness of the skin. Sometimes this dandruff is associated with psoriasis also. In scalp psoriasis, we can see excessive dandruff, but it will be predominant with more scaling in nature. Otherwise, dandruff will associated with itching and mild powdery discharges from the head region. This dandruff will be responsible for the hair loss also. But generally, in market, you might have seen that for the management of dandruff, there are n number of oils are available. Even in classics also, Durdurapatradi is one of the drug which is mentioned for the management of dandruff. Okay, Darunaka is one of the conditions. But in my opinion, if the dandruff is there, severe dandruff is there, in such condition, we should not apply any sort of oils, any sort of hair oils, because if you apply the hair oil in excessive severe dandruff conditions, the dandruff will be mixed up with this oil and stick onto the scalp, and for just for 4 days or 5 days you feel that dandruff is reduced, or maybe for 1 week you feel that dandruff is not there, there is no powdery discharge from the head, the powders are not falling from the head, and you will be happy. But what happens is this scales will be mixed with oil and sticking onto the scalp will further aggravate, and the dandruff will increase further. After 1 week, generally there will be a very enormous increase in the dandruff. Okay, so that is why generally I don't suggest oils in the initial stages of the dandruff. Okay, so first the best line of treatment is application of Triphala Churna for the if the mild dandruff. We can classify dandruff into two. One is mild dandruff and the severe dandruff. And in mild dandruff, initially the Triphala Churna can be applied for 1 week, and after removing all the powders from the head, we can go for any kind of the different kind of the oils, hair oils, like Durdurapatradi or other hair oils which is available in the market. Okay, Malatyadhikaram is there, or any other patent hair oils also you can utilize. Triphala Churnam application, in the sense, we should ask the patient first to wet the head first, and after that take 2 teaspoons of Triphala Churnam and mix it with water and make a paste and apply over the scalp, rub over the scalp. This powder should be rubbed over the scalp thoroughly, and after taking bath to the whole body, finally wash the head. That much of time you should be retained in the head. If you do this for continuous 7 days, mild dandruff will go off. Then you can apply Durdurapatradi or other kind of oils. So it will further prevent the relapse of the condition. If severe dandruff is there, in such conditions we may think about the other Bahiparimarjana Chikitsa, or if it is associated with psoriasis, obviously we should go for the Shodhana modality. If it is severe dandruff is there, we can utilize some of the Bahiparimarjana Chikitsas like Takradara, etc. And another combination of churnas, that is Chitraka Mula, Chitraka associated along with the Triphala. Chitraka and Triphala can be mixed together and rubbed over the scalp in the similar manner how we Triphala Churna is applied. So this should be continued for 2 weeks, and sometimes there will be some pustules also will be seen in the head associated with the dandruff in severe conditions. So if you apply Triphala Churna along with the Chitraka Mula, that also will succeed. It will reduce the itching over the head, and it will remove the dandruff from the head. After that, again we can go for some of kind of the Bahya Sneha, Shirasnehas, like Durdurapatradi, etc. Along with that, we can go for the internal medications like Dandaka Rasayanam or Aragadadi Kashayam. Another combination is Pudila Swarasam. Pudila means the tamarind leaf. Tamarind leaf Swarasa should be taken and mixed with the Haridra, and we should mix it with the coconut oil, and which should be prepared in Bhanupaka method, kept in a wide-mouthed plate and kept under sunlight for 2-3 days. So this oil also can be utilized for the prevention of the dandruff. Okay. Similarly, the coconut oil along with the lemon juice, Bhanupaka Taila, that also very much effective in the management of the dandruff. Okay. If it is severe, we should take it like that of the psoriasis. Okay. So that I will explain later. Alopecia. Alopecia, again, there are different kinds of alopecia. Alopecia areata, alopecia totalis, etc. So in our Ayurvedic text also, there are three terminologies. One is Indralukta, another is Ruchya, and another is the Khaditya. Indralukta, alopecia areata or totalis we can see, and Ruchya we can see alopecia universalis. In alopecia universalis, what happens is all the body hairs, including the eyelids, will fall off. And another is the Khaditya, which is simple bald-headedness. Majority conditions of baldness associated with the genetic only. So in such conditions, no effective management is there. Otherwise, if baldness is due to some other external factors, then we can manage that kind of baldness. And in Indralukta, some local therapies may be sufficient, like Prachana, etc. In Ruchya, we may have to go for the Shodhana modality. The reasons for alopecia is hereditary, stress hormones, and sometimes medicine, irregular food habits, environments, or the forceful tying of the hairs. Also, sometimes responsible for the Indralukta. The Indralukta generally caused due to Vata and Pitta blocked by Kapha and Ratta. Vata and Pitta is the main doshas, but blocked by the Kapha. So that is why there will not be the hair follicles will be blocked by Kapha and Ratta, and because of that, there will not be further growth of the hairs in that particular region. So these are the some of the types of Indralukta. So the center photograph is alopecia universalis or Ruchya, we can see, where even eyelids or eyelashes are also gone. In ladies, we can see a large patches, but very thin in nature. Sometimes the distribution of hairs also will be less. That also we can see, we can consider as kind of Indralukta. In gents, we can surely see small round patches over the head. Generally, there will be individual patches initially, and if you are not treating, they will join together and become a bigger patch. Okay. The management, as I mentioned, if it is for a smaller area Indralukta with a single patch, in such conditions, we can apply some of the external medications. There are like Indralukta Masi, etc. Indralukta Churnas are there. Or Vishwamitra Kapala Taila. That means the oil extracted from the coconut shell. These kind of Tikshna Dravyas we can apply over the area. But before application of any kind of external lepas in the affected area, a thorough prachana is very essential. Prachana, different types of prachana are there. Here, a mild form of prachana may be sufficient. For example, the area should be rubbed with a very rough leaf, gojihwa kind of leaf, or with a new rough cloth should be rubbed over that particular area for a longer period, so that some blood spots are seen and the skin becomes reddish in nature. After that, if you apply the lepas, that will work in mild patches. Okay, so if the patches are bigger in nature or two patches are joined in together, in such conditions, we have to go for the actual prachana with the suchi or any other kind of shastras. Okay. So generally, for doing prachana in such condition, the lancet can be utilized to apply pricking over the particular areas. And Nagavalli Swarasa applications. The application of Swarasa of the betel leaf is also very much effective in the milder forms of the interlupta. And Kadalavanakku is one of the drug, and the seed of Kadalavanakku also should be applied over the particular area. And rubbing of the tender flowers, the stalk of tender flowers of hibiscus also can be rubbed over the area. It's also beneficial. And sometimes the small onions cut into two, and the exposed part should be applied after doing prachana. Exposed part should be rubbed over the affected small patches. That also beneficial in the lobe. If it's larger area is affected, as in the lupa, or if it is ruhia in nature, body hairs are also lost. In such conditions, we can go for the Shodhana therapies. So, because it is blocked by kapha, even though the vata and pitta are the doshas involved in the lupa, because of blockage by kapha, first line of treatment, in my opinion, it should be Vamana. So generally in my practice, I go for Vamana in such conditions. And after Vamana, we will do the Jalovakavacharana or Prakshana. So generally, if large area is there, we can do Prachana with lancet or suchi. For that, we should ask the patient to sit in a chair and hold a cloth, towel, bath towel kind of thing over the neck, and hold it with hands from both sides. And we should ask the patient to pull the both end of the towel downwards so that it exerts pressure over the neck region. Same time, ask the patient to bite his teeth like this, so that there will be rushing of blood towards the head region. In that posture, we should pour the lukewarm Triphala Kashaya over the affected area to give Svedana, so that more blood will rush to that particular area. And after that, we should puncture with the lancet or suchi. So initially, puncture the lower part and go upwards. So that is the nature of the, it is a general rule of Prachana. Okay, so when bleeding comes for the Triphala Kvata, lukewarm Triphala Kvata repeatedly, so bleeding will continuously will occur. Once the sufficient bleeding is over, then stop the pressure, exertion of pressure, remove the towel from the neck region, then ask the patient to sit straight, then apply some Ropana Taila. Generally, we apply Murivenna Taila over the area. Okay, so this is the Prachana method in these conditions. And after Vamana, again, the other Shodhanas like Virichana is also effective in this kind of alopecia conditions. Acne. So that is another common conditions which is generally seen in your OPs. So acne occurs during the adolescent age. More than 96% of teenagers will get the acne. So there are two kinds of presentation will be there. One is the white head and the another is the black head. Okay. So increase in male sex hormones is responsible for the production of the acne. From the pictures, you can see that the bacteria will be present inside the hair follicle, and that will be inflammation of the sebaceous gland, and that will push out later. Okay, so if it is stays in the skin surface, and initially it will be seen as white-headed, and later it will be converted into black-headed in nature, microcomet. Okay, so in Ayurveda it is considered as Yavana Pitaka, Padmini Kantaka, or Mukhadushika, etc. Generally, Vata Kapha in nature. Okay, if it is simple acne, we can manage it with Shamana Ushadis. So generally, what I prescribe is Manjishtadi Kashayam or Guluchadi Kashayam, even Chiravilloadi Kashayam, because the involvement of Agni is very important in various skin diseases. Okay, whenever there is any change happens to skin, first it will be exhibited over your whenever there is any changes happening to Agni, first it will be exhibited over your skin. Okay, maybe mild discoloration of the skin. So if you see any discoloration over the skin, surely we should suspect there will be some Agni Mandata or Mandagni. So that is why Chiraviladi Kashayam, one of the very good yoga which can be utilized in Mukhadushika. Apart from that, Manjishtadi Kashayam, Pitta Kashayam, Guruchari Kashayam, these kind of Kashayams can be used. If secretions are more in the Pitakas, then you can go for Amrutotaram Kashayam, etc. Another combination generally I prescribe as Shamana Ushadhi, Kumariyasam along with Rajapravatani Vati. Rajapravatani Vati is Rakta Shodhaka in nature and which causes mild vichana also. So Kumariyasam is also Rakta Shodhaka in nature, reduces the pitta in the body. So Rajapravatani Vati along with the Kumariyasam is one of the beautiful combination for the Akne in Akne conditions. Okay, even for the males also we can suggest. Okay. Don't hesitate to give the Rajapravatani for the male because of its name. Then comes the Acne vulgaris, the severe form of the acne in the acne. So in such conditions, we should think about the Shodhana modality, like Vamana. Vamana is one of the important treatment Shodhana modality, which should be utilized in the Acne vulgaris, severe form of the Mukhadushika. And apart from that, Jalokavacharnam over the face. So generally, if the pitakas are very big in nature and painful in nature, and multiple pitakas are there, in such conditions, Jalokavacharnam will be very beneficial to reduce the pain and secretions suddenly. So that is why Jalokavacharnam also one of the important Shodhana modality. Okay. Then Eladigana Lepa. If it is oily skin in nature, the patients with acne with oily skin in nature, mild form of acne, in such conditions, you can go for the Eladiganam Churna as Mukhalep. Okay, so can be applied with rose water or with the simple water also. You can apply it to the face, but you should instruct the patient very clearly that it should be a very thin lepa. Mukhalepas are generally thin in nature, and we should not allow the lepa to dry up. Before it dries up, we should ask the patient to remove it or wash the face. Otherwise, it will cause injury to the skin surface. Okay, so before dries up means when it starts to dry up, they may feel that the skin is slowly shrinking kind of feeling will be there. When it starts, ask the patient to wash the face. Okay. Then comes the fissure sore, Vipadika. Generally, because of barefooted walking or sometimes improper hygiene or improper washing of the feet, improper application of not applying oil to the feet, the Vipadika is seen. Another condition where Vipadika is seen is associated with the psoriasis, plantar psoriasis. If it is Vipadika associated with plantar psoriasis, these external therapies or Shamana modalities may not be sufficient. Otherwise, we can effectively manage the fissure sore or plantar hyperkeratosis or Vipadika or Padadari very effectively with the Shamana Ushadhi. So there will be pain, cracks, fissures, tenderness, sometimes bleeding, or sometimes very rarely pus, and the patient may not be able to walk because of the pain and secretions. So these are some of the symptoms of the fissure sore or the hyperplantar keratitis. Mainly due to the increased vata dosha, the rukshana happens and excessive thickness of the skin happens, and because of that, Vipadika is produced. Lessening of Snehamsha and Apdhatu. in the skin. That is why Vipadika is seen. It need not be always to the foot, but it may be seen in the hands also. That is what Ayurveda says. Pani Pada Sputana. Vipadika is nothing but Pani Pada Sputana. Sputana of the Pani and Pada. For the management of Vipadika, we have developed a very simple procedure in our department, that is Pada Nimajjana. In 2010, I have published a paper regarding this procedure. The term is coined by myself. It is Pada Nimajjana. It's a kind of Avagaha Sweda, we can say, but localized Avagaha Sweda. In that, we have to ask the patient to dip the food in the tailas for certain period. Okay. This will help to reduce the Vipadika. So presently, in the last year, we have completed one PG study in Pada Nimajjana with the Mahisha Grita. Mahisha Grita. It's buffalo ghee, which is very cost effective and simple to use. Okay. So generally, I advise the patient to wash the feet first, then ask them to clear the skin surfaces by cutting the hardened skin with the help of a fresh blade, sterile blade we can say, and remove the crust of the skin and make the gaps very shallow. It should not be sharp in nature. Then after that, ask the patient to dip the leg in lukewarm salt water for 15 minutes, and after that, dry the feet, and again they should dip the feet in a combination of Jivandhyadiyamakam with Durvadikeram or Jivandhyadiyamakam along with the Pindatailam. Depending on the condition, we can select various combinations, or simple Mahishagritam. If it is only dry skin is there, simple Mahishagritam will help. Take the Mahishagritam in a plate and we should dip the leg in that and keep it for 15 minutes. The grita should be lukewarm in nature. After that, remove the grita from the foot, and remaining grita can be utilized for the next day. And after that, wash the area and apply Jivandhyadiyamakam or any other ointments like Katfar, etc. Okay, continue this for next 15 days. First 7 days itself, generally, majority of the conditions will be cured. If it is severe in nature, then continue for 15 days. Okay, 15 days of therapy will surely give you benefit. In some cases, as I mentioned in the previous slide, it may be associated with severe pain and sometimes with bleeding and pus. In such conditions, we can use the Jivandhyadiyamakam instead of Mahishagritam. Jivandhyadiyamakam along with the Durvadikeram can be utilized. And if it is with the bleeding, Jivandhyadiyamakam along with the Pindatailam will also help. Okay. And along with that, Shamana Aushadhis like Vidaryadigratam, Mahadiktagratam, Aragada Mahadiktagratam, etc., Chandraprabhavati, etc., can be utilized. For external application, as I mentioned, Jivandhyadiyamakam or Katfar ointment. Similarly, Sikata Thailam. Sikata Thailam is a simple combination with bee wax and coconut oil. It will look like an ointment preparation. That also is very much effective in the Vipadika. Then Padadari Malaharam. Then another some simple yogas like for external application are the outer shell of the tamarind, the brown outer shell of the tamarind, which should be burned and made into ashes, and that should be mixed with the coconut oil or tilathaila. That paste can be applied. Otherwise, Ketaki Pushpa is there, Ketaki Pushpa. We should take the leaf of the Ketaki Pushpa, the long leaf, and burnt into ashes. That ash should be mixed with the thaila, can be applied over the heat. This is also very effective in nature. Okay, if it is associated with the plantar psoriasis, then Shodhana plays the important role. So that is like the management of the Kitipa Pushpa or psoriasis. Then comes the vitiligo. One of the very difficult condition to treat is the vitiligo, and autoimmune in nature. Because of that itself, Acharya also mentioned. He says that double the effort we should put in treating the vitiligo when compared to the normal skin conditions. Body produces protein called cytokines that alter their pigment producing cells and cause these cells to die. Generally, it is asadya in nature, but if it is mild in nature, we can treat also. But sometimes the patches which is seen in the palmar surface or nails or the lips, in such condition, it is clearly asadhya, mentioned by Acharya. In practice, also, we have seen that such conditions are not curable. There will not be any change in these conditions. Okay. And in Ayurveda, it is called as Shitra and Tridosha Pradhana Yadi. So, in Rakta, Mamsa, and Meda is the doshas involved in the vitiligo. So, for vitiligo also, we have to go for all the Shodhanas, Vamana and Virechana. Both Vamana and Virechana should be done. Okay. So, Kushta Chikitsa, double the effort we have to do, or repeated Kushta Chikitsa or more severe kind of Kushta Chikitsa should be employed in the management of the vitiligo. Okay. So, Raktamokshana is also plays important role in the management of vitiligo. So, Shodhana along with the Shamana for longer duration should be given. If it is small patches in some localized area with one or two patches, that can be easily controlled by the Shamana Aushadhis. Okay, like Panchatikta, Nimbamata, Panchatikta Kashayam, or Chitrakasavam, or Tikta Kashayam, or Manjishtadi Kashayam, etc., will help to repigmentate the particular area. And external applications like Gajalinda Basma. Gajalinda Basma is nothing but ash produced out of the excretion of the elephant. Elephant's excretion is called as Gajalinda. Gajalinda, which should be dried under sunlight and burnt into ashes, and it should be filtered to remove the hard particles. And after that, that should be mixed with the taila, any of tila taila or coconut oil should be mixed and applied over the affected areas. Gajalinda Basma. Okay, then Rakta Mokshana is also very important in management of the Shutra Chikitsa. If it is a very old Shitra case, history of more than 5 years or 3 years, in such conditions, we should go for the Shodhana therapy. So initially go for the Vamana, then after the Vamana, again go for the Virechana. This can be repeated after 3 months or 4 months again. Okay. So during the Vamana, what generally we do here is, during the Snehapana period, we should apply the Bakuchi Bija paste. Bakuchi Bija. Carboculary means Bakuchi Bija. Bakuchi Bija should be grinded very fine paste with hot water and or Gomutra that should be applied over the affected area. This should be done during the Snehapana. After application of Bakuchi Lepa, we should ask the patient to sit under sunlight or expose the part to the sunlight. Okay. So generally, during the Snehapana, after first 3 days, generally 4th day or 5th day, generally we can see some blisters will be formed over the particular areas. Okay. So if blisters are formed, we should break the blisters with some sterile needle, etc., and remove the water from that and apply some Ropana Tailas, like Murivenda Taila or Tikta, etc., can be applied over the area to heal. So when new skin comes, there will be proper pigmentation is seen. Okay, this is one of the methods. But you should be very cautious that when you apply this Bakuchi Lepa on the eyelids or lips or all fingers, if it is for single finger, no problem. If it is for all fingers, then chances of inflammation will be there. The eyes will be swollen or lips will be swollen. So you should be very cautious, especially if Pitta predominant conditions are there, Pitta Prakriti persons are there. The chances of inflammation is very, very more in nature. Okay. And Nimbakalka along with Gomutra also can be utilized. Uh, then Bakuchi Bija, etc. should be applied. The Bringaraja fried in iron vessel should be Bringaraja with Grita, Bringaraja Patra with Grita should be fried in iron vessel, and that should be consumed regularly. Okay, so Bringaraja also can be used as a rasayana. There is a yoga available in the market called Markava Rasayana. There is only two drugs. One is Bringaraja and another is the Tilataila. Okay, this is also very much beneficial in the Shitra conditions. Then Palasakshara along with Buddha for internal use also can be used. In market, there are many patent applications also available like Pigmento and Leucodna ointment. Majorly contains a Bakuchi in them. Okay. So this is the management of the Shitra. Coming to the urticaria in Ayurveda is called as Shita Pitta because of the involvement of the Pitta and increased association of increased Vata and Kapha. Because of Acharya says that Shita Maruta Samsparsha. Because of the Shita Maruta, especially Shita Maruta Samsparsha, increases the Pitta in the body, increases the Vata in the body. This Vata further aggravates the Pitta. So, Pitta is one of the responsible factor in the Shita Pitta. Hypersensitivity reactions to allergens and urticaria develops around the loose tissue of the eyes or the lips. And majorly it is associated with itching. Sometimes the patient may say that after taking bath, after coming from soon after the bath, feels itching for some period. Some people say that after sitting in the AC, they feel itching over the body. And some people say that after exposing to the cold wind, they feel itchy. And there is some tests also you can do. If you this is a severe, this picture you can see skin writing. It is written on the skin itself. Okay, so this condition is called as dermatographia. This is seen in severe conditions of the urticaria. If you write over the skin with a key like this, if you write over the skin, after a few minutes, 1 or 2 minutes, you can see the letters appearing over the skin. Okay, this is severe form of the urticarial rashes. Okay, sometimes the patient may feel itching after sweating. After sweating, when they sit in a idle for a sometimes in a particular place, and if the wind blows, the body gets cooled very fast. At that time, they feel itchy. It's also different presentations of the urticarial rashes. And it will be sometimes associated with the mandalas, appearance of the mandalas of the skin. Need not be always reddish in color. Sometimes it will look like just like the mosquito bite. Okay. So in such generally this happens in Pitta Prakriti or Pitta predominant persons. Okay, especially in Pitta predominant seasons also. Okay. The